Okay, so I'll be covering the KFP component of the written exams. As per the examination handbook, the objective of the KFP is to assess your clinical decision-making skills. So as part of the examination, the questions posed to you clinical scenarios, and through your answers to the different questions, the college then assesses your ability to make that decision-making process so you don't miss key steps. This is just a brief overview of what I'll cover tonight as part of the KFP section. So I think the best way to prepare for the examination is to be familiar with the format and what to expect on the day as well. So I'll cover the examination format, the question structure, the level of knowledge, how to manage your time, and we'll practice on some questions as well at the end. So in regards to the format of the actual examination, it's a computer examination typically. I think perhaps in some centres they may have a paper version, but I believe the majority of centres will be computer-based. It will be for 3.5 hours because of the universal allowance of an extra 30 minutes. So for every candidate, we will get 3.5 hours. There will be 26 cases in total over those 3.5 hours, but each case can have a different number of parts to it, I guess. Each of the 26 cases is of equal value, and usually the response will be in a short answer format. In terms of the structure of the cases that they present, each case will have a clinical stem. That clinical stem will give you details, key details in regards to the clinical scenario, such as the patient's age, the gender, and key features in terms of their history and perhaps examination as well. The questions then will follow the clinical stem, and these questions will often relate to different parts of the consultation, such as the history, diagnosis, tests, and management. It's very important to read the question very, very carefully, because the question will ask you for specific areas to answer. So really you want to be answering the question that they pose to be able to get the marks. In terms of the questions as well, they will usually ask you for a specific number of answers or of options. So it's very important from a marking point of view to give only the number of answers that they want you to give. In some cases, they may not actually score you 0 for providing more answers than they require, but they will sort of dock marks from that case. In addition to that as well, if there are very critical aspects of the answer that you haven't put down as part of your answer, then often you'll also lose marks for that as well. I believe, as Ash had said before, that they may be reviewing that process, but as per the handbook at the moment, that's the structure they're using. Also, as part of the questions, there's likely to be certain questions which you will need to interpret investigations such as blood tests, ECGs, X-rays, and also clinical photographs of skin rashes. In regards to, I guess, an approach to the KFP exam, I'm going to sort of harp on this point, but it's very important to cover to only provide the actual number that they request, because if you do provide more, then they will penalise you for that. So as an example of that, if they ask you for a list of 4 investigations, you can't simply just say, I would perform blood tests. You have to be quite specific with what type of blood test, and also then provide different aspects of the blood tests as separate answers. So in this example, a full blood count would be quite distinct to a liver function test, and you couldn't clump them together as one answer. If you do clump them together as one answer, and then you provide 3 other answers, then they will, then you will lose marks for that, because in essence you've provided 5 answers. And along that line as well, in terms of answering the questions, you should be very specific with your answers. And it's, I guess the hardest part is to try to gauge how detailed your answer needs to be, as opposed to not providing enough information. So I guess the point is that you need to be quite succinct. So if you were referring to an ECG and you identified that it was that there was FD elevation, for instance, in the inferior leads, then you should put the diagnosis as an acute inferior myocardial infarct, depending on the clinical stem as well. This is, again, for example, distinct from something like just writing myocardial infarct, which might get you half the marks, but not all of the marks. Also, in terms of answers where there's multiple, where they ask you for more than one option, there are certain answers that will, again, score you more marks than other ones. So I'll give you an example of that in a moment. I guess one of the main questions, one of the recurring questions is, how much do I need to know to be able to pass the test, to be able to competently go through it? So the general answer would be, you need to have the knowledge at a level where you can practice safely in an unsupervised setting, basically in any general practice setting in Australia. So it doesn't mean you need to know everything, doesn't mean that you don't need to, you can be very broad, but you do need to know a level of detail which will allow you to be safe, to look after real people in the real world. And there's been a lot of questions about check as well, so we'll answer that at the question time. But the check program, or the check issues throughout the several months in the year, are an excellent resource in terms of trying to gauge a level of knowledge. Some certain checks can actually go into probably a lot more detail than actually is needed for the examination, but it's a pretty good litmus test in terms of testing yourself for that. If you can pass the questions at the end of the check issues, then I think you'll have no problem with passing the KFP and the AKT. In regards to time management, the timing, I guess, will be, well, at least I found personally, that the KFP went very quickly compared with the AKT. I think with the AKT, I think I probably had about 30 to 40 minutes at the end to look over answers. The KFP, I was struggling to finish all of the cases on time. That may not be the case for everyone, but you're very much shorter for time compared with the AKT test. As I said, it's a 3.5-hour universal time limit for all candidates, and that's to allow for, as Sumit said, people with issues in terms of, say, typing and reading and things like that. But to be fair, they've just allowed 3.5 hours for everyone. That basically means that you have about 7 minutes per case for each of the 26 cases, and that gives you roughly about 5 or maybe 10 minutes to look over your answers as well, if you can follow that. Of course, not always, things don't always go to plan, so trying to get to that 7 to 8 minute mark per case and moving on is going to be a good strategy. As Sumit said as well, in terms of the computer examination, there's a time bar on the left-hand corner of the screen. So you can use that to follow how much time you have left, how much time has elapsed, and again, go by that to make sure you're not spending too much time on one single case. Again, just as Sumit said, you can flag certain questions of each case to review at the end. Make sure that you don't go and flag all of them, or else you'll get to the end and then you have to review all of them again, which is quite tempting to do if you're not quite sure about the answer. The other big tip that I would suggest to practice time management is to try to get used to doing things under examination technique. So you don't really get the pressure unless you do time yourself when you're doing practice papers, or when you do the practice examination paper that the college sends out about a month before the actual examination. So time yourself, and that'll give you an idea of how quickly you need to go.